mass spec is not a new technique, but it's being recently applied for the diagnosis and monitoring of patients with monoclonal gammopathies. So at diagnosis, we can get more information from mass spec as compared to serum protein electrophoresis and immune fixation. We can identify more peaks as compared to the main peak identified by immune fixation. And some of these minor peaks we have seen that are the unique biomarker that we can use to follow patients after treatment, thus avoiding repeated bone marrow aspirations or repeated PET-CTs, which is an important thing. So also, as compared to immune fixation, mass spectrometry allows us to identify glycosylation. So glycosylation, we are in the process of investigating if these can be related to certain clinical characteristics of myeloma, but we don't know yet. We are in the process of investigating it. And so far we have investigated if glycosylation is related with progression-free survival. In our trial with our data, we have not seen that, but we need more data to confirm this. And then, so a diagnosis, these are the main advantages, I would say, of mass spec as compared to immune fixation. And then in the follow-up of our patients, so mass spec seems, well, I would say that it's quite clear that mass spec is more sensitive than immune fixation. In our studies, approximately 20% of patients found to be negative by immune fixation are mass spectrometry positive. And we have also seen that among these patients, mass spec positive by immune fixation negative, that is in complete remission, in conventional complete remission, these patients, if found to be mass spec positive, they have a worse outcome in terms of progression-free survival as compared to immune fixation. So that means that the extra sensitivity associated with mass spec translate in a better progression-free survival. So, and the last advantage that I see with the use of mass spec as compared to immune fixation is that mass spec allows the discrimination between the M protein of the patient and the monoclonal antibodies that we are, currently use for patients with myeloma at all lines of treatment. So, it allows us to better establish the treatment response because it can differentiate between the M protein of the patient and monoclonal therapeutic antibodies.